So, good morning, everybody. So, I do want to take the time to express my condolences and my prayers to the people that lost their loved one on Sunday that we reported yesterday. That brought us up to 130 people that have lost loved ones in our Albany County. So, again, my condolences and prayers go out to the families through these difficult times. But as of today, we have now 2,427 positive cases of the coronavirus, 564 people under mandatory quarantine, and it's an increase of 5 positive cases since yesterday. 3 are healthcare workers, and 2 didn't have a clear source of infection. So again, tracking down the other 2. 8,629 people have completed quarantine. Out of those, 2,392 tested positive for the virus have recovered. That's an increase of 11 recoveries since yesterday. We still have 7 people in the hospital with the hospitalization rate at 0.28%, and that's the same as yesterday. And unfortunately, we still have 2 people in the ICU. So that's what we watch when we talk in the control room, when we talk every 3 days a week now at 1,400. Basically, is the hospitalization rate, and we talk about people in the ICU, even though we had that bump where we started to go up a little bit more, and then we came down, and it changes. And thank goodness we haven't seen 20 new cases in a couple of days now, but it's really the hospitalization rate that we're worried about in the ICU, as long as it's not affecting people like it did 5 months ago. We are completing our 23rd week into this, and it's 160 days today. So it's been a long haul for everyone. It's been a long haul for the small business owners. It's been hard for the workers that had to stay home, for the workers that had to come in, and also for people to reimagine what the new world looks like as you come out after being home for so long. So again, we're there and we'll get through this together, working together in a partnership. But over the last 5 days, there's been an average of 6.2 positive cases, and yesterday's average was 7.8. If you look at the trend that 7 positive cases on Sunday, there were 4 positive on Saturday, 5 the day before that. So, again, it's good that we're staying below the double digits, which we keep talking about. But I encourage people to continue to do the vital thing. Stay 6 feet apart, wear your mask, cough into your arm, continue to clean your hands, and we'll continue to get through this. I'd like to remind everyone it's a marathon, not a sprint. And I said this, 160 days ago. It's going to be a long haul. And we're hoping for not a second wave. We're hoping to keep the hospitalizations rate down. And I know it's been tough for everyone to try to get back to working, open up, and get back to some type of normalcy. If you compare New York State to the rest of the country, we're doing well. The governor's doing a great job keeping the infections rate down. I know not everyone's happy with his decisions, but listen, I'm not at times too, but again, the reality is you gotta look at the numbers, and the job's getting done, and it's the leadership that we need that has gotten us through this so far, as we face not just a health crisis, but we face an economic crisis as we continue to move forward. I encourage people, whether you have signs or symptoms, to get tested at UAlbany, as always, in the Seth Q Arena. The number is 1-888-364-3065, as always. And then we have our mobile testing site through Whitney Young, throughout the community, still running it into different neighborhoods, but please call. It's free, same as the state. No one, will pay for it. If you don't have insurance, the state is totally free, whether you have the insurance or not. 518-465-4771. And also Rite Aid, go to riteaid.com for the Colony drive-through, which is still up and running, in the Purdy one in Gilliland, as always, 518-867-8040. So please just follow it. We'll get through this. Do what we continue to practice what Dr. Whalen and I have said for the last 160 days of continue to do the right thing, and we'll continue to get through this and wear your mask correctly. I know Dr. Whalen does a better demonstration than I do about wearing the mask, but it's it's not funny, but still to see people with it under their nose or under their chin. And unfortunately, Liza, I think of you every time I go, man, they must have not watched Liza on this when I see it under their nose. And I get it. It's different. I walked down here today, and I can't tell you, I wish I had a dime for every time I forget it, and I got to go back. I'm like, oh, I can't get on the elevator. I got to get my mask. even though we've been into this for 23 weeks, it's still hard to have that habit of saying, oh, I got to put a mask on to go to the bathroom. I got to put a mask on to go out in the hallway or go to this. So again, please, everyone, do the right thing and continue to socially distance. Some of the good news that we got about gyms reopening, which we've been waiting for, I've been advocating for, because one of the things I did say, if we're opening up schools in the fall, and you're keeping bowling alleys and gyms shut down, it's kind of doesn't really make sense. We need to get back to normalcy, and and as I talked about mental health, and I set up the mental health hotline for the second day into this, one of the things that for a lot of people for their mental health is working out, is going to the gym, running on the treadmill, elliptical, we're going to hot yoga. It's that type of stuff that keep people of saying, hey, look, your temperament goes down, maybe you're just tired from the hard workout. It's stuff like that that really helps people get through crisis, and I've seen more and more people that wanted to open up. But I do want to make this clear. We have a lot of discussion to make on this. It's 17 pages. We just got the guidance. It's 17 pages long. We have to sit down with Dr. Whalen and her team. We have to sit down with our attorneys. We have to figure all this out, how we're going to do this going forward. I know the startup date soon, August 24th, with 33% capacity starting on that date, but there's a lot of stuff we have to do. I already reached out to Bill Leah, who runs one of the organizations, and talked to him this morning on this, of where they're at, and I can tell you more, and Jessica will talk about this more than me, but I know a lot of the gyms are already up and running and they got stuff, but we got to figure out what the guidance, the rest of the guidance is, and there's a lot of stuff in that 17-page that we received, and we have to go through it and do our due diligence to make sure we're protecting the county and make sure we're protecting the consumers that are going to come into these establishments. So for bowling alleys too, opened up at 50%. Every other lane can stay open. Got to wear a mask the whole time. Can't go to the bar. You can eat food in your area. That's about it. But again, good news, because there's a lot of people that like to go out bowling, or they want that certain normalcy again in their life, and so which is good. For the gyms too, though, and everyone, they're required to have the MERT 13 filter ventilation for the system or better. I know there's some different wording in the 17 pages that people have to look at. Again, I know not all air handling systems can handle that. So there has to be a way around that, and quite honestly, there's a lot of different stuff we found out about our buildings about trying to go to that filter that A, we couldn't, or B, it's really not going to do. It's no different than a filter that's 10, 11, or 12, or 9. So again, this is coming from the manufacturers, not from us. And then you got to look at, can you get it done? That's the other issue, because it became such a hot commodity when the governor announced that malls and everyone had to get this done. It's been tough to get a hold of. So these are things that we got to pay attention to. The other thing was the bottle refill stations at gyms can be open. Water fountains cannot. Congregate showers cannot. Single showers can, but then they have to be cleaned after every use immediately. So these are I just wanted to put out some of the stuff that we were looking through. But again, the full set of guidelines was posted to New York Forward website, so please go there. And I would imagine every gym owner and everyone else has. Again, one of the things we're defining too, because we got to inspect like hotel gyms, university gyms. So this is something that we really got to sit down and talk about and do the priority. And for us, it's the small owners. And then it'll be the bigger ones, and then when it comes to hotels and resident gyms that are in apartment complexes will be done last. And no offense, we just got to get the priorities of getting these business owners back up and running, so they can, obviously try to survive to get through the winter, because it's been tough enough on them. So, as we continue to address this through the gyms reopening, unfortunately, movie theaters were not. I advocated for movie theaters too, socially distancing, spread out through the theater. Again, all this stuff has to open up eventually anyway, and people don't realize the ripple effect this is having on us. If you have looked at hotels in Albany County that have closed, that aren't reopening, restaurants that are eventually going to shut down, restaurants that are worried just to get through the winter, when it gets colder, if they can't get full capacity back in the restaurant, how are they going to survive into next year? And if there's no bailout from the federal government or from the states or the counties, I don't see how a lot of them are going to survive. And we're in that recession. and that recession's only going to get worse. And if you look around this country, it's hitting Florida now, Pennsylvania, Georgia. They're all starting to go into recessions because they've been a couple months behind us on this virus. So again, it's going to be challenging, and you're going to see a lot of people lose their jobs. A lot of people, the companies aren't going to come back, and it's going to be a struggle. And I'm not, again, trying to scare anyone, trying to brace you for what's coming forward. And I can tell you, other than me and probably the governor of New York, Dr. Whalen's probably more nervous about the flu season coming up and a second round of this outbreak if that happens. So, and I'll let Dr. Whalen talk about that. But one of the good people we have here from the Hot Yoga's owner, Jessica Fuller, who obviously I did the ribbon cutting there. It was awesome. She did tempt me to do that, and I go, listen, I don't want to be sweating crazy here, but awesome facility. And that was only, about a year ago you opened that up?
Yeah, just a little more than a year ago.
Yeah, and it seems like yesterday, and then you're dealing with this, and it has to be a struggle for you going forward of how you make this work, and you've been shut down. But I'm going to let you speak.
Yeah, thank you.
Yep.
So Jessica Fuller, I own the Hot Yoga Spot with 5 locations across the capital region. I also co-own CrossFit for the People with my best friend, and I think I'm in a really good position to speak about what's going on with the fitness industry right now, since I have 6 closed businesses in the state of New York. So even though I'm here representing them, I'd like to think that I really represent all of the fitness business owners in this state, because we're all scared, we're all worried, we're all nervous, we don't know what's coming. And in the last 5 months, I've spent more time texting with them, brainstorming, commiserating. So I'd like to speak on behalf of my situation, but really keep in mind my situation right now is not unique. There are tens of thousands of fitness business owners in this state and the people that work for them that are unemployed right now. And not only are we unemployed, but we still have business expenses. So not only am I paying my mortgage every month and my 2 young children, I have a 3-year-old and an 8-month-old, I need food on the table for them, I need a roof over their heads, but on top of that, I've been making 6 rent payments every single month for 5 months. My monthly rent is more than my yearly mortgage, and I've done that now 5 times with no income. That comes from personal savings, that comes from college savings accounts. So please remember, this has been my situation, but a lot of fitness business owners are in this exact same situation that I'm in right now. So it's been really challenging. When we all shut down in March, we knew it was for the greater good. We were scared, but we did it. We willingly did it. We wanted to flatten the curve. We wanted to do our part for the community. We had confidence and faith at that time that we were looking at a few weeks, a month or 2 maybe at the most, but we really felt we were going to shut down, do the right thing, and then our needs and the needs of our community were going to be prioritized. As soon as we could open, we'd be able to. Unfortunately, we don't really feel like that is the case anymore. The curve has been flat in this state for a really long time, and we were part of the phased reopening. We were pulled out of that more than a month ago, so it's been really challenging as a fitness business owner that hasn't been receiving any support from the state, from the county, like Dan McCoy said, to just keep pushing through and keep paying those rents and try to keep, my team with a little bit of income coming in, try to make it through. So it's been really challenging, and I think there's 2 problems at play. The first is what I just spoke about. We're real people with real needs, and we're not a little upset. I keep hearing fitness should just stay closed for the greater good. What are they complaining about? We're not a little upset. We're literally petrified, as are so many different industries right now, but fitness, one of the first ones closed, still closed to this day. So we're not a little upset. We are very, very worried about what's coming, and I think we're within our rights to feel that way. So that's the first problem. The second problem is the fact that we cannot help the community right now. COVID-19 has been proven to kill you if you're overweight or if you have diseases related to being overweight, diabetes, hypertension, heart disease. There is one industry and one industry alone that can lessen your risk factor of getting COVID and dying from COVID, and that's the fitness industry. We were the first one closed in this state, and we are one of the only ones still closed 5 months later. So as a fitness business owner, not only am I personally and professionally having a hard time, but I can't wrap my head around the thinking the thought process behind keeping fitness closed right now. I speak for myself and every fitness business owner that I know. We opened our studios, our CrossFit gyms, our boot camps, our spinning places, kickboxing. We opened it to help people, to keep them healthy. And right now, in a global pandemic that is literally killing you if you're not healthy, we have our hands tied. And it's so frustrating and so disappointing. And as a person that lives in the state of New York, that votes, that pays taxes, it is really upsetting to me that the conversation for the last 5 months hasn't been, how do we get New Yorkers more active? How do we get them healthier day to day, week to week, so that when something like this happens, so when the second wave everybody's talking about comes back, we're healthier, we're better positioned, we're less likely to get it and to die from it. So, I mean, that's really it in a nutshell. I think the conversation needs to shift to, not waiting for this vaccine, not staying in a bubble, not, pushing off your health until later. How can you be healthier right now? And a big part of that, I'd argue the most important part of that, is having access to your fitness studio. Not only is it important for your physical health, but as Mr. McCoy was saying, mental and emotional health. For a lot of people, your time at the gym, your time at the hot yoga spot, that 1 hour a day, that's the only time you get for yourself. You have a job where you're getting yelled at all the time, or you have a really crazy family at home that demands all of your time and attention, whatever it is. That time, or you live alone and you've been in quarantine and isolation by yourself for months, whatever your situation looks like, for most people who belong to a fitness facility, that 1 hour of your day is the very best part of your day. So mentally, emotionally, and physically, New Yorkers need access to their fitness communities right now. And I speak for myself and every other fitness business owner when I say we are so disappointed that we have literally had our hands tied and been unable to be there for them in the way that we should be and the way that would actually help this state move forward.
Jessica, thank you. And again, you are the backbone of our communities, and you said correctly that a lot of people need this for their mental health. They need it to their time to themselves before they start their day, or at the end of their day when they come after work. The plans I've seen, for the most part, and the gyms I visited at a request from people, they have done it. They've done a good job, but we have to get through that 17-page documentation we received today with our attorneys and our health department and figure out how we're going to do this as we go forward. But I definitely agree. As the infection rate's down and we're looking at opening schools, I'm glad we've kept it suppressed, and I wouldn't change it, but we can't afford to shut down again. I know we can't. No, the economy's not going to stand to be shut down again. And there's so many other factors in there, and I think my counterpart in Rensselaer County's brought it up, Steve, a couple of times. The high rate of suicide and drug overdoses that are going on. It's tough. It's tough out there, and gyms do help people get through that day, and really just have a more relaxing outlook on things. But as the infection rate is staying low and more businesses are getting back, some of the things I still want to discuss are the 20 to 29-year-olds. I've identified that a long time ago, but now it's really going up to 40-year-olds that are infected more, that are spreading it more, that don't realize it because they don't have signs and symptoms. And that's why we do encourage you, even though if you feel healthy, go get checked. It takes 5 minutes out of your day, and I can assure you, until gyms open up on the 24th of August and other things, then there's nothing stopping you from going to get tested. It helps us. It helps the health department, not just the epi people, but trace this of how it has affected certain areas in the county through zip codes and through neighborhoods. There's a variety of things that help, and it's not like we're going to lock you up. It's not like we're going to say call you out at a press conference and say who you are. It just helps us going forward, and the more data we get on this and how it's affected certain areas, it helps us to react to it, something else down the road. If God forbid something else happens, or a second wave happens, or if it doesn't happen, it's something else that again we can address it. So one of the things in the numbers that were positive cases that jumped up by 18 to a total of 507 was that age group 20 to 29, and but then 1 week it jumped by the 50. So that's the one thing we got to continue to watch. The 50 to 59-year-olds grew by 9 cases during the same time. And again, I talked about the 30 to 39-year-olds. And those in the age group of 10 to 19 age range increased only by 2 positive cases over this last period. But one of the things I want to show you is, well, actually, let me go to the smart board and show you. It's been a while. I forgot the microphone. So, and I know Dr. Whelan will get into all that stuff. And, again, one of the things I always look at is this age group here, which we're up at 506. And if you see the other leading numbers going up, the 30 to 39-year-olds, not that they're close to catching up to, they're at 314 in the 375. They are kind of close to catch up to the 50 to 59-year-olds. And that's what we continue to talk about. And she'll break that down in the data and the infections. So the positive results, yes, 2.91%. I know a lot of critics on our Facebook constantly talk about the numbers are low for having 305,000 population, or 320 as we like to call it. I know that number's low, but that's because people are doing the right thing. People are staying 6 feet apart, wearing a mask, coughing their arms, cleaning their hands, and they're getting us through it. So the people here in this Capital District region that we're lumped in with are doing the right stuff going forward. But unfortunately, we're still losing people. And yes, it's easy to say because they had underlying health issues or they're in their 80s or 90s. Tell that to the loved person that lost their loved one. Because every precious second you get with somebody, whether it's your mother or your father at that age, or your brother or your sister, or just your friend or your lover, it's one extra second that you get to have that memories with them. So even though they might have passed away in a year or 2 or 6 months, if it takes them a little, takes them quicker, that's all the time you lost with them. So think of that when you talk about that. But again, we'll get through it working together. But Dr. Whelan.
Thanks, County Executive McCoy. I'm going to go to the smart board, but before I do, I just want to, echo some of the sentiments from Jessica about the importance of physical activity and, keeping your body healthy. As a public health and preventive medicine specialist, we at the health, I myself personally and at the health department, we advocate all the time for the importance of physical fitness, of the importance of really ensuring that you're doing all that you can to help prevent against chronic diseases like hypertension and diabetes and other diseases that we know are exacerbated by having extra weight or being unphysically fit. This is incredibly important in any time. But with COVID in particular, it is the time that we've had at home for individuals that have been given an opportunity to be at home, to reconsider how they are living their lives. We have tried throughout this to advocate for the thought of re-engaging in physical activity. So I think that as we talk about moving forward with the phases of reopening, this is an integral portion of society. How we get our physical activity is so important. And for many people, being able to go to a gym, to a yoga studio, to a pool, to a place where they can congregate with others with similar goals is incredibly beneficial, not only from a physical perspective, but from a psychological and mental health perspective. So I do agree, that this is an important part of reopening, and it is helpful for people to kind of consider, use the opportunity that we've had, any opportunities that we have for growth through this year, to reevaluate and consider opportunities that you have yourself to improve your health, whether it is looking at how you protect yourself from COVID, which we discuss every single day, Or at the health department, we work with many people with chronic diseases, and this is important from all facets of health. So I agree with what has been said today about the importance. So looking at the SMART board, when we see the cases, as the county executive pointed out, we're still seeing the largest amount of tests positive being in that 20 to 29 age group. And we know, as we say every time, that this age group is, normally less ill than an older age group, a more vulnerable age group, a less healthy age group. So it's important for this group to know how important it is for them to control their behaviors and their illness when they are sick. So getting testing is important, but also social distancing, wearing masks, washing your hands frequently are going to be part of life as we know it for the foreseeable future. So this is still very important. Looking at the curve, we see our numbers are still down, and we're watching that and hoping those numbers remain down. Geographically, we continue within Albany to see the highest count in 12203. The cases are predominantly congregated around the city area. Now, again, the cases are where the testing is also available, so this may reflect that. As we talk about the cases every day when we come here, you'll hear the county executive say some are healthcare workers, some have other categorizations, but there's always a couple of people that we can't really trace where did they get this from. What does that mean? Well, that means that it's circulating in the community, and many people, as we know, are asymptomatic. And there is such a thing as asymptomatic spread. So for those of us that are lucky enough to get COVID and not experience the symptoms, not experience the illness that goes with that, we need to, again, hearken back to that responsibility piece so that we're not spreading it to individuals that are more vulnerable and could end up in the hospital, in the ICU, or at the worst, dead from COVID-19. The gender distribution remains about 50 to 50%. If you look at the hospitalization, if you look at deaths, we see more in Albany County. 60% of our deaths are female, 40% are male. Now, why is this? Well, it could possibly be that the majority of our deaths are in many older individuals, and women tend to live a little bit older than men, but there may be other factors that come into play. We also see continued disparity where we look at race data, where the ICU numbers for Black or African American are higher than the county demographics. This is something that we continue to track and follow, not only locally, but nationally. There are many things that come into that disparity. There are, this is likely a continuity of data, demographic, racial disparity differences that we see in chronic health indicators like diabetes, like hypertension for years. We continue to work on those and at the health department through a myriad of programs and services, and as well as looking at data to see what else we can learn. I just want to point out this percent positive result of 2.91 is over the entire time period of the pandemic. That does not reflect today's percent positive. As you see, 700 tested, 3 positive. Our percent positive is much, much lower, thankfully, than 2.9, the number that's given there. So if we look at the state demographics for Albany County, again, I hearken back to how lucky that we are that we have been able to test as many people as we have, because we get more data, we know what's going on more in our county, and we are able to give the residents a more informed perspective of what's going on. If we look for daily trends in Albany County, we continue to test a large amount of people. This number is over 1,400. We're testing around 1,000 people a day. This is from the 17th, so it's a little bit lower. It was around 800, but the numbers of positives are barely tracking at this stage. So this is all good in terms of trends, but I think that, as we open, and I think that The opening of gyms and fitness facilities is going to be important, but the other thing that, of course, we're very interested in working with individuals that are part of this opening is the school districts. So, I have a meeting this Friday with the county school superintendents to discuss more on that. We know that every single school district has come up with plans that they have submitted to the state health department, and those plans have been signed off. And we are hearing, now questions around how that's going to work. So we look forward to addressing that with our school districts, and we'll be talking more about that here as I get more feedback. All things considered, I think we're moving in a positive direction, but I do want to kind of put out there that we are going to be entering flu season, and we really want to be very cautious going forward for September and the months after. So it's going to remain important for citizens of the county, citizens of the state, citizens of the United States to continue to adhere to the important infection control guidelines of social distancing, of hand washing, of wearing masks. We are hopeful that there will be a timeline for vaccination for COVID very late in the year or very early in 2021. Flu vaccine, I would advise people to get vaccinated for influenza as soon as possible. As soon as they have a supply, it's a good idea to get vaccinated for the flu. And I would also, again, advise parents sending their kids back to school to make sure that they are up to date with their vaccination. It is really all about protecting yourself and protecting your body going forward. So that includes doing things that keep you healthy, and whether that is from a physical exercise perspective, whether that's from a dietary perspective, whether it's the behaviors we discuss every single day, they're all incredibly important. Thanks.
Thank you, Liza, as always, and I appreciate everything that you and the Department of Health has done, especially with the EPI department and the mapping and tracing and really identifying where all this is starting. But I also want to remind people it's week 14 of the Albany County Stay Safe Challenge, the partnership with PAL, AT&T. It's been going well. So one of the things we want to say is as college kids are leaving, or probably already have left, as they say goodbye, how they're doing, how they're holding their parties. Because remember, at that point, it was supposed to be under 25 people. So, but now in social gatherings are 50 or less. So please post it on there, as always, at hashtag Albany County Stay Safe by 12 o'clock or midnight on August the 22nd for a chance to win a $25 gift card. Can't wait to see how people did little parties as they left. Also, I want to remind people that our mental health support's there, available 7 days a week, 8 a.m. to 5 p.m. And the number, as always, is 518-269-6634. Don't be afraid to call. Don't be afraid to ask any questions. I know I say that all the time, and I want to make sure I tell people no one's coming to lock you up. No one's coming to do any of that stuff. I know that's been a question from people. It's not true. They're there to talk to you. They're there to get you the help that you need if you need to go a step further than the phone call, or you just need someone to talk to. So please call. Our 24-hour sexual assault hotline number, 518-447-7716, and our 211 with United Way in New York State hotline, as always. And as we've said this before, it is important to get back to opening up, because I've said this before and I'll say it again because I was talking to a few of the parents. One of our main people that identify a crisis with children are teachers. And if no one's seeing these kids, and no one's seeing them since we shut down March 12th, and they haven't been back to school, there's probably some neglect issues, there's probably some abuse issues, some things that have gone on that normally would be captured by now, and because that number is going down, and to me it's alarming, especially to people out there that are parents or not even parents. The last thing we want is to make sure we protect these children. So as we start to open up, and we need to get fully back to being open eventually and getting all the workers back in safely, we can do this together. Again, remember, it's a marathon, not a sprint. Stay safe and healthy out there.